If pain in your Achilles is stopping you from running or playing a sport that you enjoy playing, then this video is for you and you need to watch the whole of this video. Hi, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking about Achilles pain or Achilles tendinitis. I'm going to be talking about one, what Achilles tendinitis is, the different types of Achilles pain, two, what you can do for it conservatively, and three, the more invasive treatment options that you can do, and the gold standard treatment option that I feel is suitable for patients that have tried the conservative treatment options for mid-portion Achilles tendinopathy. So, the Achilles tendon is a very powerful tendon. It's made up of your three muscles in your calf and it attaches to your heel. It can get inflamed and the fibers of the Achilles can get degenerative. Now that can lead to pain in your Achilles tendon itself. Often it's while you're running, but you can also have it first thing in the morning when you wake up and it can feel quite stiff. It can get to a stage where you can't run anymore. There's two main types of Achilles pain. There's an insertional Achilles tendinopathy and then there's a mid-portional Achilles tendinopathy. The insertional one is right at the base of the back of your heel and it can almost feel like heel pain. Some people confuse it with plantar fasciitis. It's not. And it's not treated like plantar fasciitis. The mid-portion Achilles tendinopathy is slightly further up. There are a couple of other conditions that can occur in this region, such as bursitis and other types of tendinopathies, which is why if you're not sure, visit a podiatrist and have an ultrasound scan to see and confirm that you have got Achilles tendinopathy. It does show up very well on an ultrasound scan. The conservative treatment options for Achilles tendinitis are, you can massage the area. So there's different types of massage. You can just massage it gently to try and break up some of the adhesions. You can use ice to reduce the discomfort on your Achilles tendon itself. Rest is obviously the best form of recovery for Achilles pain. Stretches, so you can stretch your Achilles, your calf muscle and the Achilles, and you can do that with your knee straight or with your knee bent, which will work further down into the structures of your insertion of your Achilles. If you have insertional Achilles tendinopathy, you want to be doing heel raises. So you want to come up on your big toe and back down on a flat surface. If you have mid-portional Achilles tendinopathy, then you can do an eccentric program. So you come off the end of a step, you use 2 feet to come up, and then you use 1 foot on your bad foot, you come down, and that helps to build up strength and it helps to get rid of the symptoms of Achilles tendinitis. It does take a long time, so you've got to do 3 to 4 sets, and you've got to be doing it twice a day, and it can take up to 12 weeks. It's called the Afrison protocol for mid-portion Achilles tendinopathy. There are other things you can do. So you can put orthotics in your shoes with a slight heel raise, and that helps to offload pressure on your Achilles tendon. I don't think therapeutic ultrasound is very effective, and there's no evidence to say that it is an effective treatment option for Achilles tendinopathy. What I do think is effective is some of the other options. So, some of the options that are not conservative include extracorporeal shockwave treatment. Now, shockwave treatment is done via a special machine, and shocks are placed into the Achilles tendon, around 2000 actually, and it helps to break up the adhesions and it helps to bring new blood vessels to the surface, and it can be a very effective treatment option. You'll need more than one treatment. You'll need several treatments of extracorporeal shockwave treatment, and myself and other MSK pods, podiatrists and physios do shockwave treatment. The other options include PRP. So PRP is when we take blood from your arm, we spin it, and then we take the healthy plasma and the platelets and we inject it into the Achilles. There's mixed evidence regarding this, but there has been some really promising trials that have been done. I find it an effective treatment option in some patients. Now, what I think the gold standard treatment for patients with mid-portion Achilles tendinopathy that have not responded to normal conventional treatment, so all your stretching, all your strengthening, orthotics, rest, maybe modifying your running shoes to a shoe with a slightly higher heel to toe pitch. After you've done all of that and you're still struggling, high volume image guided injections, ultrasound guided injections into the Kager's fat pad, which sits just behind the Achilles, can be a very effective treatment option. When you've got Achilles tendinitis, you get these new blood vessels that come into the Achilles and into the Kager's fat pad. And these blood vessels bring with them nerves. Now, when you use saline and just a very small amount of steroid and local anesthetic, and you strip away all of these blood vessels, and it really helps to help the tendon to recover. There is, however, a proviso. You do need to adhere to the strict post-injection rehab program. You could potentially return back to your sporting activity in 10 days, but you need to adhere to the rehab program that myself or another podiatrist will give you if they give you a high volume ultrasound guided injection into the Achilles. And it involves the first 2 days of relative rest, and then there are other things that you can do, but you can return back to your sporting activity or to running within 10 to 15 days, which I think is brilliant, and it's a really good option for patients that have tried other forms of conservative treatment options. Hope you found this video helpful, and if you have any questions regarding Achilles tendinitis, please feel free to ask me. Thank you for listening. Bye.